Phyllis. My name's Kelly. I'll be your nurse for today, okay? So what brought you in? A headache? Anything else? A little bit of blurry vision? Did you take anything for your headache? Some Tylenol? Okay. Well, I'm just going to wash my hands real fast and I will do an assessment on you, okay? So as I'm washing my hands, I'm going to make sure that I take a quick look at my patient as far as her general appearance. I'm going to make sure I take a quick look at the room, make sure I see nothing out of the ordinary, everything's safe for my patient. Make sure I didn't see like any IV poles, anything hanging up, any oxygen administered, Foley bags or anything. So wash my hands real fast. All right. Can you tell me your name and date of birth? And as she does this, I'm going to make sure I check her ID band to make sure she is giving me the right information. Okay. Can you tell me where you're at? All right. And today's date. Good. Since you're having a little bit of blurry vision, I do want to take a quick look at your eyes. So I just want you to focus on me, okay? Take a look at her pupils. Okay, pupils are reacting good. As I'm taking a quick glance at her appearance, I notice that her skin is flushed. Her cheeks are really red. I'm just going to have you turn your head towards your left and look, and towards your right, and I do see a little bit of JVD. Okay. I'm going to feel her skin for edema or anything. No edema, warm skin and dry. Feel for your pulses. Her pulse is rapid, so I would count her pulse for a whole minute. And I got 80. Pulse rate's 92. Check her capillary refills. Capillary refills look good. Okay. Can you squeeze my fingers? Good. And can you pull towards you and push? Excellent. Any numbing or tingling in your fingers? Nope. Okay. That's good. And she can move all her extremities, which is good. I'm going to take a quick listen to your lungs. Can you just set up on the edge of the bed for me? So have her set up and listen to her lungs. Okay. Let's go and listen to your lungs up in front. Okay, right here, we're just going to listen to your heart. So I would listen to her apical pulse and count that for a whole minute. I had noticed that her lungs were nice and clear. Like I had said with her pulse, her heart does sound tachycardia. So I listened to that for a whole minute, and I would notice that her pulse was the 92, so that did match her pulse rate. One here, I'm just going to listen to your belly. Okay, she has active bowel sounds. Any tenderness on your belly when I touch it? Nope. And when was your last bowel movement? This morning? Okay. Any cough or anything? No coughs? Okay. Have you sit right there. I'm going to feel her legs. Notice her skin temperature's warm too on her legs. No edema. Skin's dry. I'm going to feel for her pedal pulses, which are even and a little fast. And then check her capillary refills on her toes, which look good. Can you pull your feet up by you? Good. And push. Good. So she had came in here for a headache, and I noticed that her cheeks were also red. I'm going to do her vitals. So once I did her vitals, I did notice her temperature was 98.4. Her pulse was 92. Respirations are 20, so she is breathing a little faster and her heart's faster. And the main thing, her blood pressure is 216/108, which is hypertensive. She's on room air and standing at 96. So I'm going to document my assessment, and I'm going to document in the correct format, the time and date, and per hospital policy. And I'm going to also let the physician know about her blood pressure because that is extremely high. Okay, is there anything else that you need right now, Ms. Phillips? Okay, I'll be right back, okay? So make sure she had her call light before I left and the room was safe. And make sure I wash my hands as I leave. Hi there, Miss Phillips. How you feeling? Good. A lot better than when you came in? I bet. Well, I am leaving today, so I'm going to give a report to Michael, okay? So this is Miss Phillips, a 43-year-old female who came in the ED for a severe headache and blurry vision. She said that she had taken 1,000 milligrams of acetaminophen and the headache did not subside, so she came in. Her vitals were 98.4, 92, 20, 216/80 or over 108, and 96%. The doctors had ordered a CBC, a BNP, and a BNP. Her BNP came back and it was at 160. They had ordered a head CT and a chest x-ray for her. She got metoprolol 5 milligrams IV push and 2 milligrams of morphine. And her blood pressure was still 204/102 with a pulse of 86. They ordered hydralazine 10 milligrams IV push. Blood pressure was still 218/110 and heart rate went up to 104. She was started on a nicardipine drip at 2.5 milligrams an hour. Goal was systolic blood pressure of 180 between 180 and 200. She was then transferred to the ICU, which they then called a stroke code on her. Her blood pressure at the time was 208/112 with a heart rate of 110. She then went into emergency surgery for a hemorrhage stroke. 2 days ago, she started moving all her extremities again. Speech came back to normal. Transitioned her from IV nicardipine to PO metoprolol, amlodipine, and hydrochloride thiazide. Her systolic blood pressure now is averaging between 140 and 150. All her education has been done on her for her blood pressure, and possible discharge tomorrow. Do you have any questions? Ms. Phillips, do you have any questions? Alright, well I hope you feel better, okay? Alright. Make sure I wash my hands and make sure my patient was good before I left, call light, and reach.